All right, we're starting to see cases rise again in Rock Island as well as over on the Iowa side of the river. Do you guys have any thoughts on what factor or what factors are contributing to that?
We haven't done the contact tracing completely yet, but we have noticed a trend of it being younger people. So we, have some theories that it could be people who went to St. Patrick's Day parties or have gone on spring breaks. We know that it's been a year and people are so tired of this, but COVID is not done with us yet. This vaccination clinic is a great sign that COVID will be over at some point, but we're a long way from that. So, you still need to wear your mask and watch your distance and wash your hands and still take those precautions. Getting your vaccine is one tool in this pandemic fight, and we're just believing that people are out and about doing what they want to do, thinking that they're done with it, so COVID must be done with them, and that's just not the case at all.
And I know you might not have those statistics on you right now, but can you remember the last time you've seen numbers like this?
Middle of October through right around Christmas time, we had horrifically high cases, regularly in the high hundreds. We cannot go back to that point. Our hospital systems were stretched. People were being transported to regional hospitals. Our own system couldn't handle it. We cannot get back to that point, especially when we're so close here. I mean, more than 50,000 people in Rock Island County have had at least one dose. 14% of our population has been fully vaccinated. We are getting there. We are very close. We just need people to hang on just a little bit longer.
How worried are you at this point?
Almost all of our efforts are being put toward vaccination. This is the largest public health effort in history, and but we're still doing contact tracing, and we're still doing the education that we've been doing for a year. Your public health team, your healthcare providers, were tired, and we know that you are too. But we really need your cooperation to, get over this last hump. And if we can stop this little spike, and compared to what we've had, it is a little spike, but little spikes turn into big spikes, and we really need to get this under control, especially since there are variants in the community. We know that there are variants, and they are more contagious, and they are affecting younger people. So this is just a warning sign. In fact, the state of Illinois put us in warning status today, and I'll have Nita talk about that. She knows more of the details on that. But I was really happy that they did, because it is a physical reminder. We will turn orange on a map, and that is, orange means warning. And you might recall when we had warning status in the past that there were mitigations. At this point, there are no mitigations, but those could be coming.
Do we know the dangers for people who have gotten one dose and then might be exposed to the coronavirus?
One dose does not give you full protection. In fact, 2 doses do not give you full protection. Remember, the emergency use authorization says that the Pfizer and Moderna are 95% effective against transmission. They are 100% effective against serious illness and death, and that's what we're most concerned about. But it is, even being fully vaccinated, you're still going to have to be careful until we reach herd immunity, and we don't know what that number is yet.
Have you seen hospitalizations rise?
Hospitalizations have been kind of ticking up, and they fall a little bit, but very recently we had more than 20, and that was concerning. And just like the healthcare providers were, they've been exhausted. They've been working full force for an entire year, and just when you think that you're could breathe a little bit, here comes this little spike, and that makes all of us extremely worried that a little spike will turn into a big spike.
And you mentioned to me at one point that being here at clinic is a happy time for you guys. To see the help that the National Guard is putting into this, what would you have to say to that?
We could not do this without the National Guard's help. We were running a very successful clinic once a week that was pretty much all hands-on deck situation. Now, your public health department is still doing everything that we normally do, but a lot of our efforts are focused on COVID. But our WIC babies still need to be fed. Our restaurants still need to be inspected. I mean, we're doing everything that we normally do on top of this. So we were doing a clinic once a week. We were vaccinating 1,000, 1,100 people depending on vaccine supply. We have the capability of doing that 6 days a week here. We don't have that vaccine supply yet, but we absolutely expect that this facility can do, 6,000 or so vaccines if we had that supply.